What do we need to know about our eyes as they get older? Dr. Chebil is here to answer just that. I'm Anita, and this is Care Experts. Today we're talking about aging eyes with Dr. Alexandra Chebil, a Harvard-trained board-certified ophthalmologist with the LASIK Center Medical Group. Dr. Chebil, thank you so much for joining us.
Oh, thank you for having me, Anita.
So can you just talk to me exactly about how our eyes age over time?
First thing that's going to happen is a reading vision problem. That's called presbyopia. So depending on the age, it can be sometimes, usually around 45, but sometimes a little younger, sometimes a little older. And this is where people who have very good distance vision all of a sudden have problems with reading. It's not really an eye problem, it's a problem with your arms. It's the short arm syndrome.
Yeah.
You can't hold the book out far enough, so you eventually you have to get your eyes checked and see if you need reading glasses. So that's an inevitable change that happens. Other things that are preventable as you get older would be cataracts, glaucoma, and really the worst thing would be the macular degeneration. So those are the last three things are sort of preventable, not always, but certainly you can do something to mitigate the damage.
And do our eyes look different as we age?
Your eyes themselves don't look different unless you develop cataracts or if you have cholesterol deposits. It's called an arc. There's a white arc that can form around your corneas that's particularly aging. The eyeballs themselves don't change, but you can get laxity in your eyelids. You can get droopy eyelids and that type of thing that make you look tired and old, but your eyes themselves don't change unless you have cataracts.
So you mentioned earlier that we start to notice that maybe our vision's changing because we're holding our book or our cell phone
Exactly.
at arm's length trying to see it. So what is this condition called and what exactly can we do about it?
It's called presbyopia, which just means aging of the lens in your eye. So the lens in your eye is meant to bend when you see something up close. If you notice in children, they can see a fly on the tip of their nose, no problem. They can accommodate and see up close. As you get older, that tissue becomes a little less flexible. So you think of it as like the little muscles around the lens don't bend quite as much as you get older. So you have to hold the text out a little bit farther over the course of time, usually, like I said, at the age of 45.
Okay.
And it doesn't progressively get worse. It stops at a certain point. A lot of people get drugstore glasses. You know, they start at about a number 1 and they go up to a 3. So at a certain point when your eye has stopped aging, which is usually around the age of 60, it doesn't get any worse than that. You can't see up close. You can't see up close, but it's not getting any worse than that.
So how would you mainly treat presbyopia? Is it just reading glasses?
Well, first you have to get your eyes checked to make sure that you don't have any other condition. Some illnesses can cause your vision to become worse, like diabetes. Got to make sure that you don't have that. But overall, the easiest fix, if your eyes are healthy and all you have is presbyopia, then reading glasses are the first treatment. You can get contact lenses as well and laser surgery.
Now, what exactly is cataracts or what are cataracts?
Well, cataracts affect the same tissue as the presbyopia. So the presbyopia is aging in the lens, and as the lens absorbs the ultraviolet light from the environment over the course of 50, 60 years, it becomes, first the lens becomes white, and then it becomes yellow, and then if you look at some of the National Geographic photos of really bad cataracts, there's actually a brown spot in the eye.
Wow.
But with the modern technology and modern medicine, we don't let it go that far.
Yeah. And how exactly would you treat a cataract?
A cataract is treated surgically. There's no medical treatment for it. You have to actually aspirate it from the eye. There are machines that break it up into little particles ultrasonically, vacuum it out, the cataract, and then an artificial lens is inserted in the eye at the same time. It's a great technology. And these implants, they're called, they can make you see far and close without the need for glasses whatsoever.
What exactly is the difference between cataracts and glaucoma?
Oh, totally different illnesses. Both of them are found more frequently as you age.
Okay.
Although some of them can be genetic and you can have glaucoma in a baby, unfortunately. But the kind that are age-related, the cataract is related to aging in the lens, so that affects your ability to see both far and close as it gets worse. And glaucoma is a problem with the eye pressure. So that is a condition that needs to be treated urgently when it's picked up, and that will be decided when you go in to have your annual eye exams, taking the eye pressure in the eye.
Is that a little puff of
That's
air?
a puff of air.
That's so uncomfortable.
There are other machines. I've got machines where there's no puff of air. It's
Okay.
a lot less uncomfortable for
Yeah.
a patient. But think of the fluid in the eye kind of like as a circulating pump.
Okay.
You know, the fountain's outside, the water is pumped in, the water's pumped out. It's the same thing, the fluid in your eye, it has to circulate. And if there's a overproduction of the fluid, the pressure can go up. And if there's a blockage in the drainage, the fluid can also go up, the pressure goes up. So that has to be addressed in an urgent fashion or you could lose your vision permanently.
Wow. What are some other common effects of aging eyes that we should be aware of?
Dryness is very frequent over the age of 50, particularly in women. Dryness is a big issue that needs to be addressed on the front end. You can also have eyelid problems. You can have droopy eyelids. You can have tear duct problems that are associated with age. And then I mentioned previously the macular degeneration, which is age-related, to a certain extent hereditary, but that also can cause a huge loss of central vision. So you could lose the periphery of your vision with the glaucoma and the central vision with the macular degeneration. All of those are picked up at your annual eye exams. Really important to maintain that.
We'll be back after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back. Let's continue our discussion on aging eyes. Is there specific age ranges maybe for men and women where they start to notice some of these conditions?
Well, the presbyopia is automatic. Men or women, I would say 45 is probably the key age where it starts. The cataracts and glaucoma, it's probably more like 50, 60, but you don't know until you get that checked to see if you actually have them.
Is there anything we can do to just help keep our eyes maybe more healthy, more young?
It's all about environment.
Okay.
So you want to stay out of toxic environments, stay away from smokers, stop smoking yourself. That's not that you smoke, but if you did, stop smoking. Diet is a key factor too. Omega-3, they're the vitamins, not necessarily supplements. You can get a lot of those things in a natural, normal diet like we have here. So vitamin A, B, C, and then there's certain supplements which contain zinc and keratin. Those are also beneficial for preventing cataracts and macular degeneration.
So it sounds like these are things that everyone can do at home themselves.
Right, exactly. Omega-3,
Yeah.
Fatty acids. And that's what they say, leafy greens and fish.
Yeah.
That's all we got to do, right?
So what would the average cost be for maybe treating something like aging eyes? I know there's different conditions and different procedures, but is there like an average that maybe someone would be spending on a treatment?
Well, if you're looking at preventing any type of aging, I mean, you're going to age anyhow, but if you want to mitigate the risks, dietary supplements, I think it's probably more like $30 a month or something like that with your fish oil and your vitamin supplements and omega-3s.
If you needed a procedure for cataracts or glaucoma, what about in that case?
Typically, medical treatments like that are covered by your insurance.
Okay. So talk to me about the financing options for a cataract procedure.
Most of the time, the cataract procedure cost is covered with a patient's insurance. The only thing that can differ is the cost of the implant, the lens that is put in to replace the natural lens. Standard implants are covered by insurance typically, but if you want to have a premium implant, premium IOL they're called, which will fix both the distance and the reading vision, that's typically not covered by insurance. It is an extra charge, and that's where the CareCredit credit card factor would be important. Great.
Well, now it's time for something fun that we're going to do. It's called Myth or Fact. So I'm going to ask you a couple questions, and you can let me know if it's a myth or a fact.
All right.
So the first one, myth or fact, weaker vision is inevitable with age.
Incorrect.
Okay.
You maintain your vision by the healthy lifestyle, by the diet, and by maintaining your normal annual eye exams, making sure you're not developing illnesses that affect your vision. And it's normal to maintain healthy vision for your entire life.
Wow, good to know. Now, myth or fact, eating carrots will help your vision? Because I know we hear this one a lot.
Carrots are an excellent source of vitamin A. So vitamin A is important for the health of your eye and overall body health. Vitamin A is found in other products besides carrots, so you don't have to stick to carrots.
Okay.
But I've never seen a rabbit wear glasses.
Yeah, I don't know. So maybe there's some truth to that, right? So myth or fact, having 20/20 vision means that you are perfectly healthy?
Incorrect. That is a myth.
Okay.
20/20 vision is just one of the factors of how you see. It means you have good central vision, but it doesn't mean that you don't have other problems. You could have glaucoma, you could have diabetic retinopathy, you could have all kinds of other health issues with your eye that even though you see 20/20, your eye could be deteriorating in spite of that. It's good to have them checked.
Yeah, thank you so much for that. That's very interesting because I think people think, oh, they have 20/20, my eyes are perfect, but that might not be the case.
Exactly.
Yeah.
Yes.
Thank you so much, Dr. Chebil.
Glad I could share. Thanks, Anita.
Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.